Right. So I would like to welcome and thank everyone for joining today. Today we're going to talk about RT injuries and will upright radiotherapy have your back? Today I'm joined with Stephanie. She's the lead of McLaren's Proton Therapy Center in Flint, Michigan. Stephanie, could you tell me a bit about your center?
Yep, so we currently have two supine systems. They're kind of McLaren's own creations here. But we have the two supine systems now, and then we actually split one room into two. So we're putting two of the upright Leo systems into the other rooms. One is installed and kind of being tested, and the other one is almost fully installed. So maybe by the end of the year, we will be treating, at least in the first room.
Awesome. So you've done some experience and worked with the workflow in Upright. I have a couple of questions for you. Could you describe how you and your staff in the supine world currently assist your patients off the supine tabletop?
Yeah, so our system actually is really high off of the ground compared to like a standard photon linac. Our patients have to get up two steps, and the table at rest is about 3 feet in the air. And then when we go to treat them, depending on how far ant to post on the patient the ISO center is, the table can be up to like 4 feet in the air. And so we have to pay close attention and make sure that the patients are getting on and off safely to get up and down those two steps. And then there's also the risk of someone needing like a lift, wheelchair patients, just needing extra help getting on and off the table.
So with your tabletop being so high, how do you think the patients kind of feel being elevated or having to get up on that table um,
A
such a
lot of
distance?
our patients say like, holy cow, that's way up there. Like that's a lot of steps. I most of our patients don't take steps at home. They live in flat houses and in a ranch where they don't have to go up and down stairs for any reason. And so it's a shell shock for quite a few of them.
So do you find yourself as a therapist being more of that aiding assistance of helping them up sometimes because of maybe limitations of different devices and stuff like that?
Yeah, especially if there's any kind of device on the table, that just increases how far the patients have to get up and onto the table. And so we do a lot of work to kind of help them and guide them and like slowly lay them back and the same thing, but and vice versa to get them on off of the table. And then almost probably 50 to 70% of our patients will then have to just sit there for a minute and collect their bearings and before they feel safe enough to walk back down the stairs to get off the table. So it adds a little bit of time to each treatment, and it can definitely pose risks of falls, being that high off of the ground.
And then you have a pretty busy center, so like what's your average, like one of the supine tabletops gantries, what is the average patients that y'all treat per day?
Between our two rooms, we treat like 35 to 42, somewhere in there on any
So it's
given day.
almost safe to so it's almost safe to say like almost 75
Mhm.
times a day you're lifting and pulling and moving patients and aiding them up and down off the supine,
Yep.
onto the supine or off the supine tabletop.
Yep.
So with all that lifting, at the end of the day, do you find that any of the therapists start to feel like experiencing pain for having to lift the patients that many times or aiding them or getting pushed and pulled on throughout the
Uh,
day?
I actually had a therapist call in last week or the week before because his back was really bothering him and he didn't think he'd be able to lift the patients on and off the table for the day.
Oh, wow. Interesting. So that brings up a good topic. We There was a recent paper done um, titled "Occupation Injuries Involving the Medical Imaging Radiotherapy Professionals." What they did was they wanted to determine the outcome of occupational injury. So hearing that you recently had someone go through taking time off because of that pushing and pulling and the therapist actually being in that stable structure for the patients, they wanted to see if there's the length of medical leave for it, the financial compensation, and then if they were able actually to do any job duties when they were able to return. So what they did was this group was out of MD Anderson. They actually went to the ASRT and they took randomly 10,000 ASRT members were invited to complete a survey. The survey was detailed about occupational injuries, experience while working in the medical imaging professional field. So basically, if they were injured or how did they get injured and what was their time away and if they were able to come back to work. So out of this study, in the study, about 401 participants, more than half of them stated they experienced occupational injuries. A majority of those injuries were muscular, 81%. 43% needed to have medical leave of less than 1 week. So Stephanie, that kind of goes in theory of what you just mentioned with your therapist who missed less than a week worth of work because of the pushing and the pulling and the stability that the therapists go through just to assist our patients because of being having to go up on a high tabletop. I can remember that when I first started the couches before we had sixed off, they would actually lower all the way to the floor. It wasn't until we started doing the sixed off and they started adding the different motors and the compartments to the supine tabletop that allowed it actually made the table taller, so it had a little bit of a hindrance for patients to getting on and off the table.
Mm-hmm.
And then 24% received actually had financial assistance from their employer. So with them being out on leave, the employer had to actually pay for that therapist not only to be out, but then also assist them during their time of need of workplace injuries. So the study really brings to highlight the prevalence of occupational injuries of medical imaging and radiation therapy professionals, with most of them being muscular injuries and short term being out for short term. The majority could resume their original jobs after they recovered from their incident. So what I'm going to do is pause here a little bit, and kind of what brings us to mind is we hear everything about the supine, and Stephanie really went through how much the therapists have to aid and help the patients get on to the tabletop. So at Leo, we've created an upright treatment device where you have a upright rotational patient positioner, which is seen in the middle, and then what you have above it is a CT scanner, a vertical CT scanner that will come down and actually take your imaging. So now what you have is patients walking in and positioning themselves or not having to climb up on steps or anything. And I'll show you a quick video of actually how everything comes in. So as you see, the therapist will select a load position for the patient, which has been saved during the simulation. The therapist would come in and then put their treatment devices on. And you notice it indexes pretty nicely to the seat pan and it's very reproducible. The patient comes in, they can walk in, we apply a shin rest to help keep them immobilized and some positive pressure so they won't move. We make sure everything is adjusted accordingly. We add on an abdominal belt to help keep some more of that forward pressure to the upper body. That way it helps them stay immobilized. And then depending on their arm position, we can give them a arm support to move things out of the field. And then as you can see, everything is saved and we can continue to do imaging. As we image, what comes down is a CT scanner. It will go down to the level that we need, and we use that for simulation data registration. You'll also see that the scanner can tilt, and that tilt is for matching the backrest. So if the backrest has a 5 or 10 degree angle, the CT will match that angle. We would then go into our imaging, our registration, and then what happens is we rotate the patient to the first treatment angle. And we also elevate it to the area that needs to be treated. And then we go to the second beam and continue to rotate to the next. So basically the patient is rotating around a fixed beam instead of the treatment, the radiation therapy source rotating around the patient in a supine position. And when they're done, it's pretty simple. The therapist comes in, they lower it down to the floor so the patient can then just stand up. They will retract the shin rest and take off any anterior devices, and the patient would just walk out. So you kind of see that the therapists now are more in contact with the patient at an eye level so that they can see the patient and they're actually walking the patient in and not having to be that support or having to be pushed and tugged and doing a shoulder press to get them up and down. The patient is more able to walk in, help position himself, so it helps saves the therapist from those muscular injuries. So after looking at that, sorry about that. So Stephanie, hearing about those injuries and then looking at the Marie setup, and you've been using the Marie setup for the past couple of months, we want to go ahead and have your idea of, or your opinion of, will this kind of help reduce the injuries that you're seeing in your current workplace?
I definitely think so. So if a patient were in a wheelchair, you could easily just slide them across. You don't have to really do any lifting like up off of the table. We don't have to use a Hoyer lift or anything like that to get the patients back and forth. Most patients will be able to just stand up, they with little to no assistance whatsoever. And then those that do need a hand, you're doing a flat like, give me your arm, let's stand up together. I think it'll be much better on the therapist's backs and shoulders and knees and head, nose, head, nose, and toes. But to sit them upright off of like the supine tables, you're literally bending in half and bringing the patients up. To just stand up, basically from a seated position or a perched position, eliminates so much of that work off of the therapist and honestly on the patients too.
Yeah, so I asked earlier about the stability and how the patient feels of being elevated in the supine position. So we had our friends at CLP, they did a study where they brought in patients after they'd done their supine treatment to come in and compare the upright treatment and their positioning. And 87% of those patients felt like they were more stable in the upright position than supine, meaning that they were more comfortable, they were able to see around, they felt like they were in tune with the treatment, where they're laying on the table, they're just looking up at the ceiling and they don't know what goes on. So they kind of feel a little bit shaken, just like you said earlier, as we raise the patient's isocenter, they don't realize that it's a 4 foot drop if they were to roll at the table.
Hmm.
Where in the upright position, they actually see where they're going and what's going on, and actually how elevated they are in the room. And then also they feel the ease of getting in and out of the system. You stated earlier that when you lay your patients up, that you have to sit there from a supine position and wait for them to kind of get their bearings. And we've all done that where we've had Miss Jones or Mr. Smith, we've helped them up and we've always said, hey, stay there for a second, get your bearings. So in the upright position, most of the patients in the study said they were 94% comfortable of getting out of the system compared to the 60% in the supine. Most of it and most of the feedback is they were ready and able to get out directly from the upright position. There wasn't that stop or that dizzy feeling that they have from going from supine to upright. Where basically they're letting the blood flow get back down, and so they felt safer in that aspect of it.
I could definitely see that. From just testing it myself on different people around the department and letting other people test on me, you just feel more in control and easier to get in and out and move around and definitely feel more secure being upright than laying flat on a table 4 feet in the air with 2 inches of leeway on either side of your body because the table is so narrow.
Yeah, I can tell you that I've been positioned multiple times in the upright chair. Um, you see at trade shows that the staff at Leo, we actually kind of fight over sitting in the upright position because what we feel is it's actually relaxing, where it takes off the pressure from our back and our feet, and so it makes us comfortable for being on our feet all day. What we don't see is other vendors who have supine tabletops. You don't see them or their staff laying on the table because it's somewhat not as comfortable as you said. It's like I recently was on a table doing a comparison, and there was a sharp difference between being on the supine and the upright. I personally couldn't wait to kind of get off because it was weird being that elevated up and just looking straight up and always waiting like
Staring
who's
at the
going to get me
ceiling.
down.
Hmm.
So so that's going to kind of conclude our talk for today. We wanted to kind of keep it short and sweet and talk about just our upright positioning and how it can help aid in reducing muscular injuries for therapists and imaging workers. Thank you for